Hi, welcome to our YouTube channel. I'm Erin, the Executive Director of Common Sense Adoption and Foster Care Services. And today we're going to talk a little bit about 15,000 kids. It's a big number, but here in Pennsylvania, in any given day, we have about 15,000 children in foster care. And Lori's going to tell us a little bit about how those kids come into care. What are those factors that leave children in need of foster family homes?
And
talk about that?
Sadly, the fact really is there's quite a few more than 15,000. And that is our role, is to try to help reduce that population of children being in out-of-home care, foster care, and also discuss the reasons why children and families need temporary care. A lot of those reasons begin, as we know, with abuse and neglect, real safety issues that compromises a child and their siblings perhaps in their environment, real safety challenges. The others are addiction. A lot of families are suffering with the challenges of addiction, especially these days, and historically that does compromise their ability to well care for the needs of their children. Also, in addition, is mental health or mental illness challenges that families are struggling with, violence, which all of these often lead to difficulty with economics, covering housing, covering the needs for medical care, health care in children. Also, unfortunately, often these same issues leads to homelessness for some families and instability. Also, along with all of those things is the lack of food and lack of resources. Ability to get education is also a big one. So we're often getting concerning calls into our system for families at risk for all these multiple reasons.
And we know that it's usually not just one issue that leads to a child's placement. So just because a family's poor or homeless isn't necessarily a reason they're going to lose their children to foster care. They're often multiple issues. So we see these complex stories that really come along with this, where there's addiction, there's maybe untreated mental health issues, domestic violence, and like you said, that also tends to flow into other problems like homelessness, food insecurity, all of that. And a lot of the time what's happening is children come to the attention of schools. That's a big referral source. Our kids are showing up at school, they don't have food, they don't have appropriate clothing, they may have marks, and it's teachers and sometimes healthcare providers that are really those sort of first responders when it comes to alerting authorities that there may be a problem in a particular home.
I think it's also important to note that removal of a child from their family of origin or from their current kin is last resort. There's often many services put in place for children so that they do not have to be placed in temporary care.
And the other part that goes along with that is that in addition to providing those services, children and youth agencies are actively looking for relatives who could take those children. If you or I were having those problems, it would be, grandparents, aunts and uncles, those close family members are often, that sort of second family that we look at as a resource. So
Absolutely.
when we talk about 15,000 kids, it's these complex, very challenging issues that lead to placement, lead to children and youth involvement, but services have been provided to that family. The state is looking really hard to find a safe family member. We call that kin resources to take those children before we pull those kids out and put them with total strangers. And that's where foster care comes in. And we don't jump to foster care in most cases until we've sort of exhausted all other remedies. Now, occasionally there's those emergency middle of the night, they just got to get a kid somewhere safe. But most of the time there's been some ongoing work to try to preserve children in their home despite the challenges. But then when we start getting to that point where foster care is necessary, we've done, a lot has happened. So we're going to talk next about the role of foster parents in helping these 15,000 or more kids that we see every day right here in Pennsylvania needing homes.
I think it's also important to note that these are children of all ages, 0 to sometimes even over 18. They have brothers and sisters. They all look differently and have unique talents, unique strengths, unique challenges. And I think that's really important to recognize the face of these children. They're living in our communities and they need some help.
Good point. That's a good point, because people, I think, oftentimes when they're picturing these kids in need, they're picturing maybe the kind of child they're hoping to parent. So they're a certain age, they're a certain gender, there's a certain number of them. And what we know from reality is we see kids from birth to oftentimes 18 to 21.
Yes.
And we get a lot of calls, don't we, about siblings? I mean,
absolutely.
And some big sibling groups.
Absolutely.
What's the biggest one we've placed?
I think 7.
Yeah. So we see.
Maybe not in the same home, but
no.
For families
we did 5
open to taking siblings, brothers and sisters often want and need to be together and certainly deserve to be together.
Yeah. So these kids, these 15,000 kids, they cover the gamut: age, gender, race, siblings, no siblings, so, we're talking about a pretty diverse population of kids.
Sure.
So when these kids come into care and we're looking to place them in a foster home, a lot of families have questions about what is the role of a, foster family home in terms of, caring for children who are in temporary care. Can you talk a little bit about the responsibilities of a foster family?
Sure. The immediate need is to try to help provide normalcy for a child. The challenges that led to any child having to be removed from their family of origin needs to kind of be brought down to some normalcy. Safety being the biggest. All the things that we know are necessary for a child: education, meet their medical needs, make sure they have food, clothing, and shelter. And those are the basics. And then we build on those things, accessing resources for them to help walk them through the complicated journey of either returning home to their parents or perhaps needing permanency through adoption.
Yeah. And the other part of what's going on with most kids when they come into foster care is we're trying to maintain connections to siblings, to birth family, which might be more than just their biological mother or father. Sometimes it's aunts, uncles, grandparents, other people who sometimes kids end up going to them. Their return home might not be to mom or dad, maybe it's to an aunt or a grandparent, but it's trying to maintain those connections and is really important.
Maintain familiarity. We often strive to keep kids in their community of origin, in their school district of origin, but we know the reality is that's not always possible. So we try to really assure that children have a sense of connections and understand their grief, understand that they have been displaced from everything that they know to be true about their little lives, whether they're young, infancy, toddler, school-age children. It's really important to recognize those needs.
Yeah. So, foster families are really kind of superheroes. I mean, they're helping children heal from a lot of hurt, trying to help them have a kind of normal life, maintaining connections that are important to them and maybe difficult but important, and ultimately hoping that we get them back home, right? But sometimes that doesn't work. And in those cases, when we can't return home, we can't find a kin resource, we know that foster families become that that family that we often consider as a permanency resource, and that would be adoption. I mean, that's where foster families might end up ultimately being the forever home for that child or children.
Right.
And that's kind of what we specialize in, right?
Yes.
Yeah.
Yes.
So if you'd like to know more about adoption and foster care, go to our links, check out our website, check out our Facebook, Instagram, or give us a call.
Give us a call. We're just a phone call away. 717-412-0772.
Thanks.